I am Mervat Nessiem Gawrgyous. I'm a technical consultant at the World Health Organization headquarters in the Health Promotion Unit. I'm a medical doctor, studied health management planning and policy, as well as counseling and non-governmental organizations management. Before joining WHO, I worked for several years in international organizations and UNICEF Egypt. So I worked in the field with community and for community in Egypt and many countries in the Eastern Mediterranean region. Through my entire work, I learned that community is the indispensable partner in our journey while striving to achieve better health and well-being. Our lecture today, we will walk together through the WHO global publication titled Community Engagement, a Health Promotion Guide for Universal Health Coverage in the Hands of the People. This publication builds on a research conducted by WHO and Maastricht University. The principal Dr. Susan Mercado. The objective of these video lectures are to explain different approaches for community engagement, demonstrate some examples for the 4 community engagement approach, present an example on a specific group engagement, which is youth engagement. Let's start by a quote from Dr. Adhanom, the Director General of WHO, who said that a strong primary healthcare platform with integrated community engagement within the health system is the backbone of universal health coverage. Community engagement is considered a crucial principle of health promotion, as it generates the shift from medical paradigm with healthcare workers' dominance towards another paradigm with a greater control over their health and well-being. Actually, since Ottawa Charter till launch of Global Action Plan, the community engagement theme is endorsed as a key to achieve not only health promotion goals, but also health-related SDG targets by 2030 at country, regional, and global level. 7 accelerators have been identified through the Global Action Plan to enable countries to achieve SDGs by 2030. The 3rd accelerator is community and civil society engagement. Before we proceed, let us see the WHO definition of community engagement. WHO defined community engagement as a process of developing relationships that enable stakeholders to work together to address health-related issues and promote well-being to achieve health impact and outcomes, positive health impact and outcomes. The cornerstone of community engagement is the human involvement, with all which makes the people with their multidisciplinary skills and talents work together hand in hand to address the health challenges in the 21st century with all complexities and specificities. There are different levels, depth, breadth of community engagement, which determine the type and degree of involvement of people. 4 approaches are presented in the publication to guide the discussion on the type of community engagement that is most appropriate to a specific context or setting. There is a range of methods and tools that can be used for every approach. Level 1 is community-oriented approach. The community is informed and mobilized to participate in addressing immediate short-term concerns with a strong external support. So community is informed with a strong external support. In level 2, community-based approach, the community is consulted and involved, not only informed, to improve access to health services and programs by locating interventions inside the community with some external support. When we go to level 3, community managed approach, there is collaboration with leaders of community to setting and decision from the people themselves, with or without external support of partners. For level 4, it's community-owned approach. Community assets are fully mobilized and the community is empowered to develop systems for self-governance, establish and set priorities, implement interventions, develop sustainable mechanisms for health promotion with partners and external support group as a part of a network. These approaches are not discrete nor mutually exclusive. One type is not better. And a combination of features of these approaches can be. What determines the appropriateness of the approach is the objective of community engagement at this context or setting. Community engagement here is a process and an outcome. Let us give examples to explain more for the community-oriented. The community is just informed. This is level 1, community-oriented. This could be adopted in behavioral, cultural, social conditions, such as vaccination during outbreak response, like now with COVID vaccination, awareness on harmful exclusion or gender bias, drunk driving, etc. For the community-based level 2, where the community is consulted and involved, it could be adopted with health system determinants, such as access to an appropriate and acceptable primary healthcare services, information program for communicable and non-communicable disease, new outlets for mental health services, etc. Third level, the community managed. Here, there is a collaboration community, so it could be adopted to address prerequisites for health, such as unemployment, lack of housing, lack of water and sanitation projects, lack of access to education for girls, food security, etc. For the level of community-owned or community-owned approach, community assets are fully mobilized. Community is empowered. Here, it can be adopted to address upstream driving forces such as poverty, poor working condition, climate change, environmental degradation, rapid and unplanned urbanization. So now we talked about different community approaches. Let us ask a question. When do we engage community? When? The answer of this question depends on the objective of engagement. However, for most of the purposes, the earlier is the better. The early involvement grants more community sense of ownership, commitment, personal investment. However, it's never community involved in your work. When community is becoming on board, they will create a positive difference at your work. The other question is who to engage. And the community demonstrates different levels of power, authority, voice, impact, knowledge, skills, and talents, ability to give. There are different entry points for engaging with communities. We have to provide recognition to all community stakeholders. In our lecture today, let us have an example on a specific important group, engagement, which is youth engagement. And instead of considering youth as a burden, They could be our change agents in their communities. The following 1.5-minute video is a lovely example for how young Victorian people are leading healthier communities.
Vic Health is partnering with local governments on a new program. They're asking us, children and young people, what our cities, towns and regions should look like and feel like, to help ensure that our voices are heard, where they matter. Our voices and ideas will shape council decision-making to help design community solutions, because we are the solution. We can create real, beneficial changes in our communities, changes that will help us all stay active, safe, connected and healthy. Want the best possible future? Let's create it.
From Mildura to Melton, we're listening to young people to understand what they need to lead healthy and happy lives. Alongside this, we're working closely with local governments to understand how we can be a better partner to make this work meaningful for their local communities. Over the next 5 years, we'll work with councils in a strategic and equitable way through communities of practice and evidence-based modules. We look forward to sharing the first steps in this ambitious journey as Vic Health and local governments work together to ensure all young people in Victoria can enjoy a healthy future.
What they said about the initiative. The partnership will amplify their voices. They mean here young people voices. So the partnership will amplify their voices, ideas, and experiences to create a healthier future. By offering meaningful opportunities where the voices can be heard, we can inspire more creative local solutions for greater impacts. By partnering with councils in this way, we will see stronger and long-standing outcomes for more Victorians. To conclude, community engagement is a process and an outcome. Community engagement is a crucial principle of health promotion as the shift from the medical paradigm with healthcare workers' dominance towards another paradigm with a greater control from community over their health and well-being. Thank you for listening.